So even though my husband and I made our peace with our own disabilities, for our children in a world that is, oh, I'm sorry, suddenly we were struggling to find help and resources for our children in a world that is not built for them. This world, which is familiar with autism, where people can quote the latest CDC data that shows 1 in 36 children are diagnosed, still has doctors who suggest that my children should not expect a good quality of life. Like the doctors themselves were encouraging me to give up without trying. It was at this moment, and I'm so sorry, excuse me, at this moment that I truly began to understand what living with a disability meant, and I got a glimpse to the struggles I would face as a parent getting access to vital supports for my children. If the state of Florida can't decide what autism is, and they haven't updated that statute since 1989, then how can they help me or my children treat it? A patient who is diagnosed with cancer is not encouraged to give up, quite the opposite. They are given resources, they are recognized, and they don't struggle with understanding from their peers or community. As a parent, I was given a diagnosis for my son, and that was it. My children don't choose to have their disability, and neither did the cancer patient. Most people today have experience with some kind of disability. Either your parent, friend, or perhaps yourself might have had some kind of connection to this world. A teacher I once knew said something that always stays with me. Disability is the only minority group that's always taking applications. If 1 in 4 people have a disability in the United States, the chances of everyone having this experience is high. And yet, we are still struggling to get access to care, resources, and acceptance. As many of you know, Florida is home to one of the largest populations of people with disabilities in the United States. Nearly 4 million people, residents in our state, live with some form of disability, which represents about a quarter of our population. Yet despite this, too many individuals with disabilities in Florida face significant barriers when it comes to accessing quality health care. With Florida ranking 40th in the nation for children's health and among the lowest in the nation in caregiver supports, our families struggle with getting through day to day. Our state's home and community-based agency has a wait list that has over 20,000 children and adults, some waiting over a decade for services. As a parent, would you be okay with waiting over a decade for help for your children? It's understandable that our legislator would be concerned with spending when the managing agencies in our state have continuously left millions of dollars unspent or mismanaged. However, as a parent, I don't feel it's my children's fault, nor should they pay the price for these mistakes. Please join me today in asking our legislature to help families like mine take down these barriers to care. Please help us ask our legislature to continue to safeguard protections for our people with disabilities against medical discrimination. This is a dangerous time to not be seen or heard. Please help our children be heard. Thank you. Thank you so much, Nicole.
Next up, I want to invite medical debt advocate and disabilities advocate Emer Roy from Orange County. Emer also has visited the Capitol with us weeks on end. And once again, we're grateful to have her back here. As she walks up, I'll say Emer has successfully helped Orange County release ARPA funds for medical debt. And she can share a little bit more about that.
Thank you. Okay, so I was part of the team, actually. It wasn't just me. But yeah, there was a team of us helped get Orange County ARPA funds that had been held over from COVID. That instead of being held over, 4.5 million was released to offset up to those within like 300 to 400% of the poverty level. So it immediately reached people that most needed medical debt relief. But anyway, hello. My name is Emer, and I'm a mom of grown kids. I've always, in the last, I guess, over 20 years, been the key primary caregiver for family members, including a parent who had lymphoma and lots of other folks since. And I guess through that, I became involved in advocacy for parents, you know, with IEPs and all the rest. I'm also a proud member of the neurodiverse community, and as Nicole was talking there, you know, late diagnosis sometimes are not ideal, so the earliest interventions are definitely the best. As you can hear from my accent, I grew up in Ireland, and Ireland, which only has a constitution since 1938, has a universal payer system. What that means is that when I worked since I was age 14, I made pay related social insurance contributions. And as a result of those contributions, the government honoured those and looked after its people. And but even if you couldn't contribute, no one died from withheld healthcare. Um, so no one died from withheld healthcare, and even during periods of political unrest. I grew up as a teenager when there were days I couldn't go into town because of car bombs and things like that. Um, so definitely interesting times. And we are living in interesting times now because behind me are a group of advocates and representing all parts of our community, including the queer community. Um, and I'm just so proud to be here and feel so privileged to speak. I don't know this straight. Like many immigrants, our family paid more tax, and we didn't really want to use the system. You know, it's kind of a thing that I even hesitated when I was giving birth to two kids. Um, and so I think this idea that immigrants, I think that I think that there's so many exceptions actually. I think that a lot of immigrants pay more and are hesitant. And also, I really struggle trying to navigate the system. For example, a I waiver application went through last August, and it was only through being here at the Developmental Disabilities Day that I met the agency of persons with disabilities, and they then acknowledged receiving it. So we can't even get on the I waiver application. And I struggled as well because on the phone I tend to have a speech disorder, and they really like talking on the phone, and that really matters a lot. We seem to have lost sight of the fact that people with disabilities have access to the Americans with Disability Acts and the Individuals with Disabilities Education Act. And those acts are federal acts, and no executive order can wipe them out, much as they might imagine that be so. One of the other examples of struggle is catastrophic coverage. The application needs Adobe Professional Creator, and so I don't have that because I'm working class now. Before having COVID, economically we were more comfortably, working class, and because I lost my job, tourist job, and then I developed long COVID. So right now, I have a hormone disorder that causes type 2 diabetes, that if untreated causes the heart to be attacked. And so every day is a blessing. I have no coverage. I'm in the coverage gap. And I don't know if I'm going to make it. I hope I do, because I've got a great sense of humor and because a lot of people rely on me. But realistically, I'm having breathlessness. I've pain down my left arm. I can't see my cardiologist because I can't afford to see my cardiologist. Can't get coverage. Look, the bottom line is we need to build Medicaid because we're better than a system that ignores its most vulnerable. We're better than a system that picks on its most vulnerable. We need to not build up systems that are picking on 1% of the population. You know, the power of the people is greater than the people in power. That's us. We're the people. We can do this. We need to hold our people responsible. Somebody's phone is ringing. Sorry. I think I'm almost done now. How am I doing for time? I tend to talk a bit much. So I guess my bottom line is we are all humans and we all deserve to exist. And building a universal system ultimately, and bit by bit improving the one we have, is going to benefit us all. And it's actually going to save costs with emergency rooms and all the rest, which I hope I don't see soon, by the way. But anyway, thanks very much. And thank you for all these advocates behind me too. Okay, much love to everybody, including the intersex and queer community. Okay, thank you. Bye.
Thank you, Emer, for being here. We're very grateful. Next up, I wanted to introduce Madeline from the Rising Voices Collective, right here in Leon County, doing work to address medical debt and more. I'll pass the mic over to Madeline.
Hi guys, my My name is Madeline Probst. I am the chair and founder of the Rising Voices Collective and a freshman at FSU. Currently, we focus at RVC, we focus on running local legislative campaigns by real local people for real local change, because the only power that matters in this country is the power that is listed in the Constitution, and that is the power of the people. Currently in Leon County, we are working on a medical debt buyback campaign, working with a nonprofit in our county commission in order to erase medical debt for Leon County's most vulnerable. Under the ACA, we are required, every major metropolitan area is required to do a community health assessment every 3 years. These community health assessments are not usually representative of our community. In 2022, the last time this survey was done, 96% of the people who filled out the survey were insured. It is conservatively estimated that 11.7% of Leon County is uninsured, and that's our conservative estimate. 76% of the people who filled out this survey were white and middle class income. That is not representative of Leon County, which holds the poorest zip code in the state of Florida, 32304, where you are standing right now. We have thousands of people in Leon County who have been unfairly saddled by medical debt because they had to make a choice between going into immeasurable debt or dying. This should not be a problem in the richest country in the world. America is not a first world country when you have to make choices between whether you can pay the rent, keep the lights on, feed your kids, or survive. We are a third world country with a Gucci belt for our richest citizens. And the way that we reverse this and bring the power back to who it truly belongs, back to where struggle is occurring, is through local change. You need to go to your legislators. They are public servants. They work for you. Your tax dollars pay them, and they need to be reminded of this fact. They work for you. And you can tell them that you support our $35 insulin cap. You can tell them that you support the Healthy Florida Act. You can tell them that you urge them to expand Medicaid and Medicare. You can sign the ballot initiative in order to get expansion on the ballot. But at the end of the day, these people work for you. They are public servants, and they need to act like it, because they certainly have not been representing me. They certainly have not been representing my family. They have not been representing the thousands of people across this country who are saddled with medical debt and have to make the decision every day whether they want to feed their kids or if they want to live another week to feed them next month. They do not represent any of the people standing behind me who took time out of their busy days. We have people who are going to be future physicians. They had to take time out of learning how to care for Americans in order to make sure that those same Americans could access the care before they can even give it. This is ridiculous. Do you feel represented? And what are we going to do about it? We're going to remind them that they work for us. The power is not with the legislature behind me. The power is not with the county commission that sits across the street. It is not with the city commission that sits right across the street on the other side. It is with the people. It is with the people here today. It is with the people who sit in committee day after day speaking against bad bills. It is the people. The power is with the people who are calling their legislators day and night, blowing up their phones to tell them that this is not okay and you do not represent me. And if you do not represent me, I will vote you out as soon as I can. And that's a little bit about what we do. But I'm also here as a storyteller. So I just wanted to share just a little bit. I would not be here if it were not for medical assistance programs. I was born to young parents, and young parents tend to be poor parents. My father had not finished college. My mother was a middle school civics teacher. When they had me, they were on public assistance. My mother had a 36-hour labor that resulted in a C-section, and I was born with complications, resulting in me having surgery at 2 weeks old. If they had not been on medical assistance, they would have been in up to $1 million in medical debt. And this was in 2005. That number is only growing. I would not be alive if it were not for medical assistance, because at the end of the day, my parents, although I love them and they love me, could not have afforded $1 million to save my life and give birth to me. And there are people out there in this country that is supposed to be the richest, freest country in the world who are having to make this decision on whether they want to have their kids, have healthy kids, have safe kids, or whether they want lower taxes. And the legislature that is currently in session behind me chooses pocketbooks over those kids every day. Ugh. Ugh. That's right. Ugh. It's shameful. They work for us and they certainly haven't been. So I think it's time we remind them next November. Every single one of the people in the Florida House is up for election. Is your legislator representing you? If they're not, tell them in November at the ballot. Thank you so much.
Thank you so much for speaking. Next up, we have one of our long-standing legislative champions, Representative Dottie Joseph, joining us. We're very grateful to Representative Joseph for tirelessly championing Medicaid expansion and many more important health bills.
Yes.
All right. Good afternoon. Good afternoon. Oh my gosh, what a beautiful day. Yes, it is. But we do not have a beautiful system when it comes to healthcare in the United States. For those who don't know me, I am Dottie Joseph, and I proudly represent Florida House District 108, which is entirely in Miami-Dade County. That's right, Miami represents. And, you know, sometimes you just got to find joy through the pain because the system is painful. And the thing is, we have to decide where our priorities are as a nation, as a state, as a people. And for me, healthcare is a right. It's not a privilege. Everybody should have access to it. Unfortunately, the system in which we operate does not recognize it as such. Because I feel so strongly about this, I filed 2 bills to address healthcare and affordability to make sure that every Floridian has the ability to be healthy, prosperous, and safe. Yes. The 2 bills I filed are HB 1507, which expands Medicaid in Florida, not complicated, that's right, and HB 1603, which is the Healthy Florida Act. Both of these together ensures that quality and affordable healthcare is accessible for all. These bills ensure that low-income families do not have to choose between paying the rent and getting the healthcare that they need. The Healthy Florida Act specifically establishes a comprehensive statewide healthcare system that guarantees coverage for all residents, regardless of income, employment, or any of the other things that tend to hold people back. It covers not only primary care, but all of your health needs: mental, dental, eye, prescription drugs, long-term care services. I'm telling you, it's a good bill. You should check it out. What are the problems that the Healthy Florida Act fixes? First of all, healthcare costs, as you already heard, is crushing Floridians. And it's something that we can fix. Medical debt is the #1 cause of bankruptcy in the United States. This bill eliminates all of these out-of-pocket costs, from copays, deductibles, and any other out-of-pocket costs that you have to pay at the point of service. That's a big deal. Secondly, the current system leaves too many people behind. Over 2.4 million Floridians remain uninsured, making Florida the 4th in the nation for uninsured. This bill guarantees that all of those people can qualify for insurance. Woo. Super simple. The third thing, we have low income and marginalized communities that suffer higher rates of chronic illness and premature death due to lack of access. What this bill does is it reduces disparities and saves lives, expanding healthcare, reduces racial, economic, and geographic disparities, ensuring Floridians receive the care that they need. Specifically, early treatment for things like diabetes, hypertension, cancer, mental health conditions leads to better outcome. It avoids ER visits and reduces the cost for hospitals and patients. So in short, like my mommy says, prevenir c'est mieux que guérir, which translates to prevention is better than cure. Preventative care saves lives and it saves money. The fourth thing it addresses is that the current system is inefficient and unnecessarily expensive. A publicly funded single taxpayer system, which is what my bill proposes, reduces the administrative costs and wasteful spending. It reduces medical debt for the people participating in the system. It reduces unreimbursed costs for hospitals. It makes sure that healthcare is not tied to your employment. I mean, if you think about it, that's kind of slavery-ish. It's giving indentured servitude. So if you ain't got a job, so you can't have healthcare, that's ridiculous. So this ensures that regardless of what job, you don't have to worry about COBRA or your costs going up or costs going down. You can have access to health insurance. Unlike for-profit insurance systems that we currently have, HB 103 makes sure that we put people over profits, prioritizing care over bureaucracy. Right now, we're seeing an alarming trend with a lot of these entities, whether it's venture capitalist funds, private equity funds, buying hospitals, and their focus is on increasing, money, profits for their shareholders. Where our focus should be on actual health care, on increasing health outcomes and decreasing costs. And we have a model. What this bill does, it puts the United States more in line with successful models in other countries. That way we can provide better care at lower costs. And I want y'all to think about that for a minute. When you compare the United States to other developed countries in the world, we suck. Quite frankly. But it's something that is easily rectifiable, and this bill does that. The Healthy Florida Act is a common sense solution for a broken healthcare system. Healthcare, as I said, is a right and not a privilege. So let me tell you about HB 1507, which expands Medicaid. You already have an idea. I feel like I'm almost preaching to the choir, but let me preach nonetheless. I am a PK after all. So it provides coverage for adults who are earning up to 138% of the federal poverty limit. That translates to a mere almost $29,000 for a family of three. That's nothing. Who are we talking about? We're talking about hardworking Floridians that fall in the gap. These are Floridians who make too much to qualify for state Medicaid, yet not enough to qualify for the federal coverage under the Affordable Care Act. That's nearly 65% of uninsured Floridians. So I'm just here to say that working class people deserve health insurance too.
Amen.
Who else would this cover? Children. Florida is second in the nation in net Medicaid enrollment losses. That's 380,000 children who now do not have coverage because of things that this administration in Florida has been doing. It also covers rural Floridians who are more likely to be uninsured. With countless clinics and hospitals being closed down, this is a way to keep those doors open. It also covers over 100,000 veterans who are below the poverty line in Florida. So if we were to pass this, all of these brave men and women who have put their lives on the line for us would be eligible for coverage. It also covers people with disabilities. And in addition to these specific groups, if we're talking about just the uninsured people in Florida, of that 2.4 million that I mentioned earlier, somewhere between 800,000 and new estimates show 1.5 million Floridians would now be covered. That is huge. And it's something super simple that we could do. Okay, so why should we do it? In addition to everything I just laid out, it saves Floridians money. Too many hardworking Floridians are drowning in medical debt. And in states who have expanded Medicaid, that debt has dropped by 30 to 40%. That is a real tangible outcome and I'm gonna fix my hair because the wind is giving me like vibes, but I'm here for it. And then, so I mean, this is a really simple policy decision that has a huge impact. It saves money, it saves lives. Expanding Medicaid actually brings money back to the state. You would gain access to $14 billion. That's $4 billion in federal funds annually. And on top of that, even after meeting our state obligations, you would save approximately $200 million per year if we were to expand it. I mean, this is like a no-brainer. It's a no-brainer for people with a brain and a heart. So with that, I'll just focus on the health outcomes and say that, you know, I'm talking a lot about money, but it's about people. It's about saving lives. If we actually believe in life, if we actually value life, then we should do things to make sure that we can preserve it, not the unaccountable, unborn that people like to talk about. I'm talking about real living, breathing people who need help now that we can help now. If you look at the cuts happening at the federal level, Medicaid is on the chopping block. If you look at what DOJ and these other entities are talking about chopping, notice everything that they're looking to chop are things that help everyday working people. Why? Because the billionaires don't have to worry about that. They have no idea what an emergency visit means to your family. They have no idea about the economic cost. Because for them, and like most of my millionaire colleagues that I serve with in the legislature, if they need to see specialists, they can hop on their private jet, fly to whatever country, get the care that they need, and come right back. It is nothing to them. I'm focusing on the people. Earlier, one of the speakers said, you don't judge a country by the folks who have all the money, but you judge that country by how they take care of the least of these, the people who don't have. And what I'm here to do and say and to fight for is to ensure that every single person who is here, regardless of anything you got going on, has the right to be healthy, prosperous, and safe. And that's what I'm here to do. Thank you.
People over profit. People over profit. People over profit. People over profit.
Thank you so much to Representative Joseph and her team. It's been a pleasure having you host us here at the Capitol today. Before moving on to talk about federal perspectives, I did want to talk more about what's happening in South Florida and pass the mic over to some of our amazing advocates from Catalyst Miami. I know. I'm going to open the floor up. It's first come, first serve. I know there are several stories around medical debt and more. And just welcome. And if you could share your name.
Yeah, my name is Paulette Darrow, healthcare. I had an incident occur with me. Because I have a medical condition, this has been beating me down for 25 years. And I had an incident a week ago. Because I didn't have the medication within my system, my medical condition jumped on me. And it jumped on me, so I had to go to urgent care and I had to go to emergency care. When I went there, I could not get my medication because the doctor said, hey, I see you in the system, but you can't get the medication. Wow, they did not cover it. And so here it is, I cannot get my medication. Medicaid, Medicare. So there it is. The healthcare system, that gap has to go. So there it is again. We have to throw them out of office on the 26th, 2026. Enough is enough. We the people have the power.
That's it.
So we cannot continue to allow them to beat us down. It's time for us to beat them down. And here it is. My credit score was 650, but now it went down to what? 215. And I had a visa with my bank, but now what they did, they snatched it because my credit score was too low. That's the story. Hey, it's real. It's occurring. One love from Miami. Hey, Catalyst. We got to do it.
All right, so I'm gonna head out. I'm just gonna say thank you all for coming. No, you still wanna talk? Sorry. No.
Just a quick interruption.
I just got committee, so I have to head on out.
If everyone wants to get together, we'll do a quick thing.
All right, so everybody come on down for a little.
All
Everybody in?
right.
Okay, back up. I want to see everybody's beautiful face. Get the corner people. Corner people, continue coming in. We're in. Hold it in. Oh, what you doing in there? Give her your camera. Give her your camera. Right here.
You got me?
I get.
You got it? Okay.
And do you want to be in it too? My staff can take it.
Oh, no, I'm good. I'm good.
All right, let's go. All right. We're just looking straight ahead. How are the people? Howdy,
All right. All right, we're going to continue. Yes, we're good. We're good. Yeah.
Good afternoon.
Good afternoon.
My name is Dahlia Perryman, representing Catalyst Miami. And this is who I am. I am a human being. I deserve health care. The people behind me are human beings. They deserve health care and to be treated with dignity and respect. I am a woman. I am a caretaker. I am a worker and a business owner. I currently have insurance, which I can't afford. What's less apparent about me is that I have several non-visible disabilities. I have chronic and critical medically controlled life-threatening illnesses. I am frequently hospitalized. I do blood work every few months. I do radiology and urgent care several times a year. At one point, just one of my medications cost $1,500. My insurance cost $700 a month. And a one-day stay in the hospital was billed at $300,000 plus. An allergic reaction to a mosquito bite, not a mosquito, a bee, netted me sepsis and an impromptu 20-minute minor surgery billed at $3,000. I make choices about the ramifications of choosing my health over having a place to stay and food daily. I have had to let my insurance lapse and let life-threatening and life-saving preventative measures go on for a year until I could get insurance again. Food, I like to eat periodically. These things not only affect me, they affect hundreds of thousands of people around the state of Florida and the world. And people should not have to worry about their medical debt affecting their credit, their ability to rent apartments, to buy homes, cars, and even get jobs, because depending on your industry, often your credit is checked before you are offered a job. Even further, other medical care also depends on past debt. I am asking that medical debt should not count against hard-working Americans. No one should be punished due to needing medical care. No one should be punished for having an illness, for being sick, or not making enough money. No one should have to sacrifice a decent place to stay because surgery left them with medical debt. For all who are here and all who we represent, our health literally is our wealth. Take care of your people.
That was beautifully said. Thank you so much for sharing. I know also in Leon County, we have tremendous health disparities like we're spoken on before. Brittany with FAMU is here in part. She wanted to share a little bit about what her patients are dealing with. Not to put you on the spot.
Hello, I am an oral health educator, and I cover Leon County and the surrounding area. As a oral health educator, I am in the communities every day speaking about oral health care and the importance of oral health care to systematic diseases. As everyone is speaking here about these diseases, oral health is directly connected to all of these issues. However, when we're out educating about oral health, we run into the issue of access. A lot of individuals are having issues with accessing oral health care, affordability. No, in the rural communities, is heavy on affordability and not having a dentist in the area. So I am avidly working with everyone here and in the community to try to bridge this gap to access and get these people the services they need. If they're diabetic, it's critical that they take care of their oral health to maintain their diabetes. So that's just one thing to highlight the importance of maintaining oral health care. Especially in the surrounding counties around Leon County, they're overlooked, and these are our rural communities, and they need this access more and more and more. Thank you, and we're continuing this fight daily.
I know I put Brittany on the spot, so thank you for Brittany. Thank you all for applauding. I know at this point a lot of our friends and activists at Catalyst Miami do have to leave. I want to open up the mic for those who are still here who might want to share their story. I don't want to close this out before everyone's had a chance to speak, but I just want to thank those who might not be able to stay until the very end for being with us. This has been beautiful so far. Thanks for sharing your stories and being here in solidarity with us. Any other storytellers? Yeah?
Okay. Hi, my name is Jade Bowers. I am a medical student here with Students for a National Health Program. I am also a pediatric nurse, and I used to be a nurse for children with cancer. Going off of what our colleague from FAMU just said, I will speak to oral health being part of whole health, and especially for children. You would be amazed how many children come into the hospital missing teeth and having to get tooth extractions in the hospital because they can't get them anywhere else. And so going into my experiences as a nurse in Florida, I have had the opportunity to work in Gainesville and Clearwater, St. Pete, and Tallahassee and take care of patients. And I have also worked as a nurse and volunteered at free clinics in states that have expanded Medicaid. And it makes the difference in care striking, and it makes it clear just how intentional the choice is to keep Floridians sick. I have been in free clinics in Florida where people have had heart attacks, where people in the waiting room, where people have been sent by ambulance because they have had life-threatening blood sugars, because they haven't had access to their insulin for months because they can't afford it. I have seen wounds that will go on to get amputated. People are truly, truly suffering from lack of access here, and there's never enough providers, there's never enough appointments at the free clinics, and in states where they have expanded Medicaid, truly people are not presenting to the waiting room with life-threatening conditions, not in my experience, because they can go to the hospital if they have to, and they can see a primary care doctor when they need to. So these problems that we have are unique to Florida, and they are fixable with the Medicaid expansion. Medicaid and CHIP also cover half of America's children, and children in Florida are disproportionately affected by issues with Medicaid and the disenrollments that happened last year. The only reason most of the children that I saw were able to get the care they needed, both for chronic conditions and especially my patients that I deeply care about who have cancer, was because of Medicaid, and their care would not be even remotely affordable. Even with private insurance, it is very difficult for them to get the care they need. Medicaid is their only lifeline to getting treatment for their cancers that would otherwise kill them within months. The difference between Medicaid here in Florida and elsewhere is it can be a real fight for patients to get the care they need. So in Florida, working with families with cancer, I have plenty of t-shirts with the names and sometimes faces of the children I cared for and cared about, because all of the families here had GoFundMes and fundraisers that they needed to have because their children having cancer was financially devastating for them. And when I've worked outside of Florida, that just doesn't happen. People get the care they need, and no one should have to think about picking up multiple jobs when their child gets diagnosed with cancer. People shouldn't have to go on to all sorts of government services just to be able to feed their other children. It should not be the primary thought process when a child is diagnosed with cancer to be, how will I afford this? So it is essential that in Florida we expand Medicaid, and also the $35 insulin cap would help so many Florida families be able to afford the insulin they need for children and parents here. And on top of being, a nurse and a medical student and hopefully future pediatrician, I'm also a patient. I've had thousands of dollars in medical debt, and I've also, going off of what we talked about with oral care, I have my first dental appointment in 2 years because I haven't had dental insurance for 2 years. I could not go a single week without between jobs because going to the hospital or not being able to afford my medications could genuinely kill me. So, I think it's important to have people with those experiences be welcomed into medicine, into healthcare, and be able to support our patients and advocate for them getting the care they need.
Woo! Awesome. Thank you, Jade, for closing us out. That was, a beautiful provider and patient story. Thank you, Andrea and Emer and Patrick, for also sticking it out. To all the folks watching at home, I want to thank the organizations who also showed up in support. One Voice Brevard, Catalyst Miami, the Florida Health Justice Project, Jacksonville Now, the Jax Queer Coalition, Rising Voices Florida. I know, not all of you could stay till the very end, but it was incredibly meaningful to capture your stories, to, say these words and share these stories in this important place. So thank you all for being with us and being with Florida Voices for Health. It's a privilege to work with you all. Woo-hoo.